Weak legs might not be a leg problem at all. If you have lumbar spinal stenosis, the real reason your legs feel heavy, tired, or unreliable when you walk may be coming from your lower back. That's why so many people spend months trying to strengthen their legs, but still struggle to walk or even stand for very long. The good news is you do not need complicated workouts or painful exercises. In this video, I'm going to show you 5 simple movements designed specifically for people with lumbar spinal stenosis. But here's what makes them different. Most stenosis exercises focus on stretching muscles. These exercises focus on creating more space for the nerves in your lower back. And when those nerves have more room, your legs often work better. That's important because most people with stenosis are not only looking for stronger legs, they want to walk farther, stand longer, and stay active without constantly searching for a place to rest and sit down. Be sure to watch all the way to the end because missing even one of these exercises could be the reason your legs continue to feel weak and walking keeps getting harder. Exercise number 3 is my favorite because it's simple, gentle, and many people feel the difference almost immediately. Let's get started. Hi, I'm Dr. Tam, a chiropractor here in San Jose, California. Before we begin, it's important to understand why these exercises are different. If you have lumbar spinal stenosis, the weakness, heaviness, cramping, or even fatigue you feel in your legs is often related to pressure on the nerves in your lower back. Lumbar spinal stenosis is a narrowing of the spinal canal, often caused by age-related changes such as ligament thickening, bone spurs, arthritis, or disc degeneration. These exercises are designed specifically for people with stenosis. They focus on gentle flexion-based movements, which means bringing the spine slightly forward. Now, this position helps to create more space around the nerves and may reduce the compression, contributing to leg pain, weakness, and difficulty walking. We avoid excessive arching backwards because extension narrows the spinal canal even further and can make symptoms worse. Another thing that makes this routine unique is that you don't need to get down on the floor. Most of these exercises are performed seated or standing with one simple movement that you can do on your bed before getting up in the morning. That's what makes them easy to do. These exercises have helped many people reduce their leg pain, decrease back pain, improve walking tolerance, and restore strength and confidence in their legs. As always, only do these movements that are comfortable for you. Never push through the pain. If an exercise causes discomfort, reduce the intensity or stop altogether. If you are unsure whether these exercises are right for you, check with your doctor first. Let's start with exercise number 1, the double knee to chest stretch. If your legs feel heavy, weak, or stiff when you first get out of bed, this is the perfect place to begin. We start with the double knee to chest because, it can be done right on your bed. This stretch gently places your lower back into flexion or a forward bent position. This is specifically important for people with lumbar spinal stenosis because flexion helps to open up the narrowed spinal canal, creating more space for the nerves that travel into your legs. When those nerves have more room, it may help to reduce the pressure that contributes to your leg pain, the heaviness, the numbness, and even the weakness. It's a great way to start your day because it can help to reduce morning stiffness before you're up and moving. It's also an excellent stretch to perform before going to sleep to help relax the lower back after a long day. The goal is to reduce stiffness, ease nerve irritation, and help your legs feel stronger and more reliable. Let me show you how to do it. So you're lying down on your back, knees bent. What you want to do is go ahead and bring both knees up to your chest, like such. And in this position, go ahead and grab onto your knees. And you want to take a deep breath in, blow it all the way out. As you blow it out, go ahead and bring your knees into your chest like that. And then hold that position 15 to 30 seconds. Now the goal is not to jam your knees and your thighs into your chest. The goal is to just provide a gentle, deep stretch, opening up the back right through here. You should feel a nice stretch at that area and without causing pain, okay? And so you want to hold that again, 15, 30 seconds. You can do 4 to 5 repetitions. Now the important part is when you're done holding it, don't just let it go and drop. Because if you do that, that can create your spasm in your back. So what you should do is instead of just dropping it, you can either slowly drop your knees down or hold one knee and allow that other leg to drop and then the other leg to drop following that. Okay? That's how you do double kneaded chest. Now that we've started creating more space around the nerves with a flexion-based stretch, let's build on that exercise with number 2, the seated backward pelvic tilt. We like this exercise because it teaches you how to create lumbar flexion while sitting upright, which is a position we use throughout the day. For people with lumbar spinal stenosis, this gentle movement helps to open up the spinal canal and reduce pressure on the nerves that can contribute to leg pain, heaviness, and weakness. It may not look like much, but this simple movement teaches your body a position that often feels much more comfortable for stenosis than sitting with an arched lower back. The goal is to improve spinal mobility, reduce nerve irritation, and help your legs feel stronger and more supported when standing and walking. Let me show you how to do it. You want to go ahead and sit on the edge of the chair so that your knees are at 90 degrees, okay? In this position, go ahead and put your hands on your hips. And the goal is you want to go ahead and imagine that you're pushing your belly button into, imagine there's a wall here, and you're pushing your belly button from the front into the back. As you're pushing your belly button in, you're actually contracting your core when you're doing that. So push it in, and you want to rock your pelvis forward. So the action is this way, almost as if you're sitting back into the chair. So this is the motion here, sit up nice and straight, contract from the core, pushing the belly button in, and then sitting back and rocking your pelvis forward. So again, it's like this and like that. So this is 1 repetition. Come back to neutral. This is 2, 3. And so you want to do 15 to 20 of these movements, okay? And you can do 2 to 3 sets. And again, when you're doing this, don't push into pain. Obviously, if you have pain in your back, you want to just go right to the point of discomfort and then stop. Do it again. And eventually, you're going to get to a point where you can really go a little bit more. And the goal is to open up that space here in the canal so that you can have less discomfort and pressure on the nerve, okay? Obviously, if this hurts, stop. And you can try again later. Exercise number 3 is one of my favorites because it gives you many of the benefits of the traditional cat stretch without having to get down onto your hands and knees. Instead, you can use a kitchen counter or a sturdy surface for support. For people with lumbar spinal stenosis, this exercise encourages gentle lumbar flexion, which helps to open the spinal canal and create more space around the nerves that travel into your legs. Most people notice that their leg symptoms feel worse when standing upright with an arched lower back. This movement helps to move the spine in the opposite direction. The goal is to reduce pressure on the irritated nerves, improving spinal mobility, and help your legs feel less heavy and more dependable when you're standing or walking. For this exercise, the most important part is the rounding phase. That's the position that places your lower back into flexion and may help reduce and create more space in the spinal canal. Avoid dropping your stomach towards the floor or arching your back backwards like the traditional cow position, as that extension can sometimes aggravate stenosis symptoms. The movement should feel gentle, like a gentle stretch across the lower back. It should never increase leg pain, numbness, tingling, or weakness. And if it does, reduce the range of motion or stop the exercise. Let me show you how to do it. So if this is the countertop that you're going to use, go ahead and go shoulder width apart with the hands, okay? Put your hands there. You want to step back, all right? And the key is you want to go ahead and push your hands down into the table, and then you want to pull back. Now, as you're pulling back, a lot of times what we'd like to do is what we're used to doing is doing this kind of motion where we're having our head up and we're sticking our butt out. So we want to actually do the opposite with this, right? So we're going to go ahead and bend your knees. So don't have your legs straight. You want to have your knees bent. Bend your knees. You're going to pull back and you want to arch your back, and you want to thrust your hips forward like that, okay? So again, what we're doing is we're taking the hips here and we're pushing forward. We're arching our back and pushing in like this. So the belly button, okay, is we're contracting our abs through here. Okay, so we're starting here in neutral. So not like that, in neutral. Go ahead and round your back, push your hips forward, contract the abs and hold. So I want you to hold that position for about, a count of 3 to 5 seconds and then release. Do it again, 3 to 5 seconds and then release. 3 to 5 seconds and then release. And you want to do that for 5 to 10 repetitions. You can do 2 to 3 sets. And the goal is you want to have less of the pressure on the nerves and less pressure on the back. If you feel more pressure, once again, stop the exercise, come back again in an hour or two and do it again. And if it still hurts, this may not be an exercise for you. By now, we've started improving mobility and encouraging more space around the nerves. Exercise number 4 takes that a step further. This is the seated flexion with deep breathing. Now, we like this exercise because it combines lumbar flexion with slow diaphragmatic breathing. 2 things that can help relax tight muscles around the lower back. For most people with lumbar spinal stenosis, the forward bent position helps to open the spinal canal and may reduce pressure on the nerves that contribute to leg pain, heaviness, and weakness. The deep breathing component helps to relax into the position without forcing the stretch. Many patients tell me that this exercise feels especially good after prolonged standing or walking. The goal is to reduce tension, calm irritated nerves, and help your legs feel more comfortable and capable during daily activities. During this exercise, you should feel a gentle stretching sensation across the lower back, hips, and buttocks. Many people with lumbar spinal stenosis also notice relief in their legs because the forward bending position places the lumbar spine into flexion, which helps to create more space in the spinal canal and around the nerves. You should not feel increased leg pain, numbness, tingling, or worsening symptoms. If you do, reduce the range of motion or stop the exercise. Let me show you how to do it. So in a neutral position, right? Sit up nice and neutral. We're not arching our back, okay? Hands on our thighs, and I want you to slowly tuck your chin towards your chest and then begin doing a bending motion at your waist, okay? So we're gonna go here, chin to your chest, and then you're gonna slowly bend at the waist. Now, the bending movement, if this is providing you relief, stop here. If you can go a little more based on your flexibility, you can go all the way down to your thighs, maybe to your knees, to your shins, and even to your ankles if you can get that far. The key is you want to go only as far as it feels comfortable. Now, you should feel a gentle stretch here in your lower back. No pain. Once you reach a comfortable position, let's say, for example, you get to right around here, and this is a comfortable position for you, I want you to relax your shoulders. Take a deep, slow breath through your nose. Exhale, and allow your body to relax a little deeper into the stretch without forcing it. And hold that there for 3 to 5 deep breaths. And remember, on that exhale, really just allow your body to just relax into that stretch. You're going to feel your whole body just melt into that stretch, and hold that there. 3 to 5 deep breaths, okay? And then come on back up. So when you're holding that move, you want to do that for 3 to 5 deep breaths. That's going to be 1 repetition. So you can do 3 to 5 repetitions, okay? And you can do that 1 to 3 times a day. Again, make sure no pain and you're actually feeling a nice, comfortable stretch in the lower back. Hope that helps. Our final exercise is the shopping cart march. This one is different because instead of focusing mainly on mobility, we're now working on standing tolerance, walking endurance, and helping your legs function better in an upright position. If you've ever noticed that walking feels easier when leaning on a shopping cart at the grocery store, there's a reason for that. That slight forward lean places your lower back into a more flexed position, which can help create more space in the spinal canal and reduce pressure on the nerves. Most people with lumbar spinal stenosis, this often feels much more comfortable than just standing completely upright. The goal is to help your legs build strength, confidence, and endurance while keeping your spine in a position that is typically better tolerated with stenosis. During this exercise, your legs should feel like they are working, but your lower back and leg symptoms should remain comfortable. Most people with lumbar spinal stenosis notice that they tolerate this position much better than standing completely upright because the forward lean places the lumbar spine into a slight flexion. This helps create more space in the spinal canal and may reduce pressure on the nerves that contribute to leg pain, heaviness, weakness, and fatigue while walking. Let me show you how to do it. So go ahead and stand behind a sturdy kitchen countertop, high back chair, or a walker, something that provides support. So I'm going to use this countertop right here. You're going to go ahead and place your forearms or your hands onto the surface and go ahead and gently lean forward. Similar to how you would lean forward, on a shopping cart. You want to go ahead and take a step back like I am right here. Go ahead and allow your body just bend slightly forward like an angle like this with your hips. Okay, you want to keep your back relaxed. You want to avoid standing completely straight like this or upright, right? So kind of leaning forward, bent forward like that. Now, from this position, I want you to slowly begin marching in place by lifting one knee a few inches off the ground, then alternating to the other side, back and forth like that. Okay, you want to keep marching slow and controlled. So it's not like this. Slow and controlled. It's not a speed exercise. This is a slow, controlled exercise. Continue breathing normally while you're maintaining this forward lean position. Now, if needed, I want you to start with short intervals and you can gradually build up your endurance. Okay? So what I mean by that is you can march for 30 seconds to 1 minute initially. And then as you progress, you can increase that to 2 to 3 minutes as tolerated. And you can perform this 1 to 3 times daily. Okay? Notice the speed, just like that. Hope that helps. Leg weakness, leg pain, stiffness, and finding yourself walking in a bent forward position are all common signs of lumbar spinal stenosis. The good news is that now you have 5 simple exercises that may help create more space around the nerves, reduce irritation, improve mobility, and help your legs feel stronger and more reliable when you're standing and walking. After you try these exercises, I'd love to know which one gave you the most relief. Was it the double knee to chest stretch or the shopping cart march? Drop a comment below and let me know. And if you got value from this video, please give it a like and share it with someone who may benefit. It really does help reach more people who are struggling with a lumbar spinal stenosis, leg pain, and walking difficulties. Remember to subscribe if you want tips on how to protect your spine, better understand your condition, and learn about the treatments that help people find long-term relief. And if you're wondering what the next step looks like beyond just these exercises, the next video you should watch is this one right here. In that video, I'll explain how non-surgical spinal decompression works and why it may help people achieve more lasting relief from spinal stenosis and leg symptoms that come with it. I'll see you in that video.